The people in our lives dread going to the doctor's and dentist's office, but we take this as a luxury. Everybody in the United States has access to medicine and medical care. What most people seem to forget behind the cell phones and TVs is that over 1/3 of the world's population does not have access to medicine essentials for their health and survival. Doctors Without Borders is an international organization that provides assistance to populations in distress, to victims of natural disasters, and of armed conflicts. They face some of the most dangerous epidemics of the time and are the reason why it doesn't spread. They were on the front lines with the Ebola treatment in Africa. Doctors Without Borders, or Médecins Sans Frontières, has been running since 1971. It first started with 2 doctors who volunteered for the Red Cross, but the Red Cross did not provide medical care. This is what caused them to create this much-needed organization. It originated in France, but now has become an internationally praised organization. Currently, MFS is working in 60 countries, but they have created hospitals all around the world. They provide a large number of medical care, from surgeries to vaccinations to maternal care. They are also a major humanitarian organization, bringing problems to light that developing countries endure. They work as an advocate to these countries and its peoples. They have been able to help refugees escape their homes to seek protection and security in other countries. There are constantly new diseases forming all over the world, and the subject of needing medicine is a reason to donate. There is a constant need of funding for research and program activities. In 2010, MFS received a total of $264 million. This amount of money is nothing to the amount of healthcare needed around the world, and healthcare is definitely not cheap. MFS does not receive funding from the U.S. government or pharmaceutical companies. This allows them to stay impartial and avoid conflicts with the goal of their work. They face the majority of their problems when treating patients. Most of the people are hard to treat because of the medicine for them are too expensive or no longer produced. Diseases like tuberculosis, measles, or malaria are widely spread in third world countries. The problem arises when trying to afford medication to a disease that hasn't affected wealthy countries for years. MFS has treated millions of people and are responsible for giving them back their lives. MFS faces diseases you don't see often in America, but these diseases are causing thousands of people their lives. Every year, malaria kills around 660,000 people. Most of these deaths occur in sub-Saharan Africa. In 2014, MFS treated around 2 million people for malaria. You may think you can only volunteer if you are a doctor, but that is not the case. Nurses and any medical official can, and people who are good in finances and logistics are also needed. If you'd rather stay in an office, there is volunteering, internships, and staff needed at the main sites. I plan on being a nurse or a doctor in the future. The only way I can see myself as a good doctor and human is by helping MFS and providing medical care to people who desperately need it. Also, the fact that they provide medical care impartially around the globe make them a real humanitarian organization determined to help as many people as possible.